Hi, we're group number 7. We're going to be talking about exploring professional nursing communication. I'm Hannah.
I'm Kelly.
I'm Jenny.
I'm Julie.
I'm Matthew.
And I'm Jerome.
Awesome. So, starting off our discussion for calm and respectful boundaries, first question is, what strategies do you use to maintain a calm and respectful tone when setting boundaries with patients or colleagues?
Well, I would try to make sure and keep a appropriate level of professionalism and then try to remain from asking them all the why questions, like why are they here for, why they're doing this, why do you take so long to go to the hospital, all those questions so they don't feel pressure on them. And then I'll also respect their boundaries, such as if my patient wants to rest and then I would just let them rest and then come back when they feel more ready, or if they don't want their vitals to be taken, or they don't want a student nurse to give them medication or have assessment on them. I'll also respect that. And then I think it's also important to speak with a calm and professional type of manner between my patients or colleague, and just maintain give them eye contact.
I think those are really good strategies. I also think that it's really important that we remember that when we're dealing with both our patients and colleagues, we're all just people trying to get through life. Their patients are usually in their darkest moments, so we're supposed to be there to give them that support that they need. And then colleagues, we understand as a colleague that we're all under the same stress, and I think it's important just to be mindful of that in order to maintain that calm and respectful tone whenever we're communicating with each other.
I think privacy is also a big one with your patients in order to maintain those boundaries. Because lots of times in the hospital, I feel like a lot of patients feel like their boundaries are kind of crossed being in the hospital. Is there somebody constantly watching them and, you know, overseeing their every move? So I think just kind of ensuring that they still have that kind of privacy. Like, for example, if you take them to the bathroom, be like, oh, I can wait outside and then let me know when you're done, type of thing, or, you know.
Okay, so we can move on to the next question. Can any of you guys share a specific example where setting boundaries positively impacted the situation?
I think I had one in actually my most recent clinical, like this past week. I had a situation where my patient, they were had a past medical history of like Parkinson's, and they were also easily irritable. Knowing this, I came in, I asked them like, "Hey, is it okay if I like do my assessment on you? Like, just gonna be a couple of quick questions and then I'll be done." They seemed like they were a little bit irritable that day, so they actually declined my request to do an assessment. So instead of like kind of pushing it further and like trying to go ahead and say like, oh, can we just do it really quickly? I promise I won't take that long. I just told them, okay, I understand, and I just left, and I ended up doing my assessment on someone else. But I think that was the positive way to go about that, because then it still like ensures that I'm doing an assessment on someone that isn't like super irritable and like won't help me with my questions and stuff. And it also helps him with his boundaries, like whether or not he just didn't feel like doing it or he just wasn't in the mood. But I think that was like a positive outcome in something that happened with like boundaries and stuff.
Okay, we can
Yeah.
move on. Oh,
Oh, I have
okay.
also had like a similar experience with that just recently as well, just respecting the boundaries. I had a patient as well who was kind of irritable, and when I went into the room, she was asleep and everything. I asked her if doing the assessment was okay, and she told me no, she'd rather not do an assessment, and I think it was important to respect that boundary that she wanted her privacy to be maintained and just did not want that assessment. And so just respecting that and just respecting their decisions as well.
I think we can move on to the next topic, managing anxiety and handling insults. So the first question is, what techniques do you use to manage anxiety in stressful patient interactions or challenging situations?
Me personally, I try to use a very calm voice with the patient and to more or less hear them out and be more of a listener instead of someone who's talking, constantly talking to them. Like I try to ask them to tell me how they feel and I let them go on and just keep talking and just sit there and listen.
I think it's really easy to like just go outside real quick and like take a deep breath because sometimes like the anxiety is so high. You're like outside their room, you're about to assess them, and it's been a while. Like the first day back was like literally the worst feelings of stress ever. And then talking to them, like you realize it's not as bad as you think, but I think in the moment it's easy to just get caught up in all the feeling of just like, oh, they probably think I'm dumb. Oh, I don't know what I'm doing. Oh, am I meant to be here? That type of deal. Yeah. I think it's
Yeah, I agree with that as well. Taking a second outside of the room um, really helps and, gathering composure because it's important to keep that composure inside of the room as well, especially in situations like that. So, just taking a second to gather yourself and keep that composure.
okay. Next question then. How do you handle insults or negative comments from patients or colleagues without letting them affect you personally?
So for me, I try to like understand it from their perspective because the patients when they come in, they're like under a lot of stress and fears because they're like suddenly diagnosed with a medical condition they never expected. And so they're in a lot of pains. They're also under medications. So I try to like understand that this isn't like their usual. They're they're in a lot of pain and they're waiting for their doctor to reach back to them about any new like insights into their conditions or when they can be discharged. And the doctor like it takes a while for the doctor to come into the room and talk to them. So they're like under a lot of pressure, just waiting for that as well.
I also have had like some things with patients and like was it, yeah, it was insults or negative comments. Mine are kind of harmless. I actually had a time where I think it was like a few weeks ago when I went into a patient's room and I took a vitals, and when the vitals machine beeped, they looked at me and they were like, "Ni hao," and I was like, "I'm not Chinese, man." But I think a lot of those harmless comments of like, like so like just like I guess like things like that, I kind of just let it go because a lot of our patients are like super old and like sometimes they're not completely there, and like I kind of just like understand that we're in like different situations, as well as like what Jenny said, they're like there and like they're going through some things that we don't know about. I think kind of just like putting ourselves like what how Jenny said in their position, I kind of just understand that it's a different perspective.
Okay, we can move on to the last topic, reflecting on personal experiences. So, what personal strengths have you identified in your communication with patients and colleagues?
So recently, when I spoke with one of the patients at my hospital, she kind of acknowledged how she likes how I'm very like attentive to her and like spoke very positively and like brightly with like a bright smile. They kind of like sense her positively, like good vibes and everything. And think so like my strengths include like trying to like being like attentive to my patient, like listen to like what they want, and then like just do my best to like kind of help them and like just do like everything like very attentive like right away so that I can just do like help him out and then try my best like also like kind of spread like positivity to her, so kind of like brighten up her day a bit as well.
For me, I noticed that a lot of patients when they come in, like they like to share like stories about themselves and like their own experiences. So I learned to like just be uh like just more attentive and more of a listener and to be empathetic to whatever they're going through.
Okay, next question is, how have your personal experiences shaped your approach to communication in nursing?
For me, I think in my like personal experiences, I've kind of learned that everybody communicates in different ways and, receives communication from others and like interprets it differently. So you kind of just have to go about that when dealing with patients and stuff is like everybody is going to be different and going to react differently to what you say and how you say it. So I think it's important to like remember that as a nurse.
I also really agree with what Julie was saying earlier about like the importance of really giving attention to whatever the patients are saying. A lot of the time, I feel like the nurses are so caught up in doing, well, the other nurses are, our instructors are so caught up in doing like whatever else they need to do, whether that be like passing meds, scanning whatever, like assessing the room or something like that. And I've noticed there are times where a patient is saying, "Oh, I need this," but like they're kind of like in their own little world, at a moment, so they don't catch it. And then it's like our opportunity to advocate for the patient and be like, "Hey, they said this, like they need this pain medication, or they were talking about how they felt this way yesterday." So just making sure that you have or that advocating and like communicating is important for both yourself and your patient and whoever else you're talking to.
Yeah, I think it's especially important since we're like, I guess, one person and we're only assigned like one patient while the nurses are like assigned up to 8 patients or something like
Yeah.
that. I think it's definitely important for us to advocate for them since we have more focus on them.